The son of LeBron James, Bronny, is out of the ICU after going into cardiac arrest during practice at USC. Many are wondering how this can happen to a seemingly healthy young athlete. Let's bring in now Dr. Mark Morocco. He is a professor of emergency medicine. So welcome to the show. Thanks for being here. So many questions after this. How does this happen to a young, healthy, athletic guy like Bronny?
Well, good morning to both of you and to the Los Angeles viewers. It's very sort of like shocking to folks who follow these young people who are heroes in all these sports, and to say, how can someone who is that age, who is so well conditioned, and how can this happen to them? And the answer is, in Bronny James's case, we just simply don't know enough to really tell you what the problems occurred. It's really great news that he was so quickly out of the ICU, and we don't really know exactly what happened yet. So when I tell people in the emergency department in Los Angeles, we have two great universities who've been pumping out trainees, from emergency physicians to sports medicine doctors to paramedics. One of the largest pre-hospital care schools is here in Los Angeles. So when your kid goes to practice, the things that you worry about, there are people now on almost every level of sporting events, from trainers through pre-hospital care folks, sports medicine folks, who are able to help with these problems. And for somebody like Bronny James, whether he can go back to playing or not is going to depend on exactly what happened to him. But the things you can do to help you feel less sort of scared and anxious about this for your own kid is you can learn CPR. I tell every single person, if you want to have something you can do that can help your son, your daughter, your neighbor, or just a bystander, learn CPR. And also Google AED, right? The automatic electric defibrillators that you see in malls and airports now, and be familiar with them, because those, in somebody who has true cardiac arrest, whether they're a professional athlete or just somebody at a casino playing cards, whether or not they have a really good chance of survival often is whether or not they get really good CPR from the beginning and get a shock when they need it.
Well, I think parents don't realize this happens more often than you think in so many different types of sporting venues. I've been told before that you should check the ice hockey arena, the basketball arena, see if an AED is even able to be located in those areas and know where they are, and as you said, learn how to use them. I think people are wondering now, he was very quickly resuscitated and taken care of. It sounds like they did use an AED on him very quickly. Does that speak to then how badly the damage to the heart could be, and maybe he's got a better chance of recovering out of this and getting back to playing basketball?
Well, Jamie, your point is exactly right, because your chance of helping somebody in a sporting event is more likely somebody in the stands with you than one of the people on the field. So that's absolutely an amazing point to emphasize. But in terms of what happened with him, we know that in all comers who have cardiac arrest, and remember, that's where you have a true standstill. If they get shocked and they survive, they do better, right? If you don't get shocked with an AED and have true cardiac arrest, your chances of survival are actually like 1 in 10. So wow. When you come to an emergency department with that kind of history, your chances of a good outcome just walking out of the hospital, let alone playing at a level that any of these elite athletes would want to play at, is very, very low. So that helps everybody across the board as members of the society and the citizens of Los Angeles and the area. If they know how to do CPR, know how to use the AED, they can do a lot of good over it's a big city. There are a lot of people out there. There's a million different high school and junior high, and there's sports leagues everywhere, and everybody's kids are playing things. That will actually have an effect on folks here. Now, with this young man, Mr. James, I mean, we just really don't know enough. So this is not a heart attack, right? The way that we simply think of heart attacks. This is a cardiac arrest. If it occurred and the heart stopped, it's usually an electrical abnormality. You see them in sports figures because they operate at such a sort of high level, right? So they're kind of like the fighter jets of the human body. So they're always being tested. So any abnormalities will be, usually they come up to the surface early on, and people discover them when they're children. So this is very rare. It's very interesting. We can only wish the best for the family. They're lucky to have a lot of resources and lots and lots of people who love them and follow them. And, ultimately, we hope that he has a long, happy, healthy, productive life, whether he's on the court making the shots or whether he's doing something else in the basketball world or whatever he wants to do.
Absolutely. And what does his recovery look like based on what you know as a medical professional as far as treatment, therapy, time, how long he can be active again, and when he can practice again?
Well, whether it's LeBron James's kid or your kid, if you're in Los Angeles, this city has a tremendous resource environment of very, very specialized folks who do nothing but look at cardiac events and what you need to do afterwards. So he's going to see a number of super specialized folks who are going to look at the structure of his heart, the electrical patterns of his heart, the wires that carry those electrical patterns, the rhythmic centers that set the beat, right? As well as a lot of other things that can affect cardiac activity. So he's going to get a super duper physical that's going to be both general and very specialized. And then depending on what they find, it may depend on that will change what could happen, right? So in many people, and there's one that people are most commonly aware of, is folks who pass out who end up getting a pacemaker, right? And whether you're a young person who gets a pacemaker or more commonly, you're somebody who's a little older, that's because your heart either slows down or speeds up or gets into a funny place where it doesn't pump right. And if it doesn't pump well, you either pass out, you feel dizzy, or you just feel crappy all the time, medical term, right? You feel terrible, right? And then after they do all these studies, first of all, we'll do a lot of stuff in the emergency department if you're really sick, but then you go to the cardiologist or the electrophysiologist or the pediatric cardiologist, and they figure out whether or not you are having the right function, and then they'll apply either a semi-surgical fix like a pacemaker or sometimes a true surgery, but mostly it's about rehabilitation and return to function and monitoring to see if it's going to happen again.
I like those kind of medical terms I can understand.
Yes.
Feeling crappy.
we all know what feeling crappy means.
Yes, of course.
Well, thank you so much for joining us, Doctor. A lot of questions, and of course, we will all be watching this, and a really good reminder to learn CPR and be familiar with all of these emergency scenarios. Thanks so much.
You're welcome, Jamie. You guys have a good day.
You too.